Every Friday, well, just about every Friday for about the past 15 months or so, we have been visiting with folks from Imperial County and getting updated information on the COVID-19 pandemic. And today, no different. With us on the telephone today is Imperial County Public Health Department Director Janette Angulo, and with her is Rebecca Terrazas-Baxter. Good morning, ladies.
Good morning, Carroll. Morning.
Okay, a lot going on. I mean, just all sorts of things going on. And among those things, we're counting down to the governor lifting almost all of the restrictions or mandates, if you will, that have come down from the state. And, that's one of the things we want to talk about. But first off, Janette, we kind of want to get an update on the numbers. We look at the numbers and we see that the number of active cases is, well, dramatically lower than it has been in quite a while.
It has. It is very low. When it comes to cases and positivity percent, we're also looking at very low numbers. To give you an idea, on Tuesday, because the state updates its case metrics every Tuesday, we were at a 2.9 case rate per 100,000, and our positivity percent was at 2.3%. That's a 7-day average. So really good there. So yes, looking much better for us in Imperial County.
Okay, speaking of that, testing, I know it's still going on. How important is testing? Okay, my wife and I have both had 2 doses of the Pfizer vaccine. Do we need to get tested?
That's a great question, Carol. So testing, just in general, testing, yes, it's still recommended. Let's keep in mind the pandemic is still here. We are still seeing cases, although a small amount. We are seeing some cases. Then we have what we call breakthrough cases, which means some folks have been vaccinated, but even after getting vaccinated, they may end up with the virus. So if anyone is feeling symptoms or has, some doubts, testing is the way to go. And we still have testing resources in Imperial County. But let me go back to the breakthrough cases. We have to remember that although vaccines are great and effective, there's that very small percentage that, again, may end up getting COVID even after vaccination.
Okay, and one of the things that was pointed out to me by my nephew, who is a writer, a reporter for the Battle Creek Enquirer in Michigan, that one of the theories is, okay, the folks that are not getting vaccinated, and that's their choice, I understand, they are encouraging variants of the COVID-19 virus, either giving the modified strain or variants of that virus to take hold.
Variants, yes, that's a great question. Comment about variants. We are seeing variants throughout California. There's a couple of them. We have the Japan, Brazil variant, the UK, the West Coast, or the California variants that are of concern. And then there's another one that we're keeping a close eye on, and it's the New York variant. So most definitely there are variants out there. And so the great tool that we currently have, it's really effective. Moderna, Pfizer vaccine, J&J. It helps us, it protects us from the virus. From hospitalization, from the disease. But we are seeing those variants. We are seeing those variants locally. And that's where we're at. So if you can get protected by getting a vaccine, we highly, highly encourage it.
Okay. And what about a booster? I know it's still early. Things are happening on the fly, if you will. Am I going to need a booster?
that's still a question that doesn't have a clear answer. A booster is currently being worked on. The information we have is that it's going through, the trials, and they still don't know if it'll be a booster just for a certain population, for the entire population, for the older. So those are the questions that we're waiting on to get answers on.
Okay. And speaking of the vaccine, it is available, right?
It is available. Let me tell you, we have over 30 access points in Imperial County. We have 6 sites. We have mobile units. We have clinics going on at school districts, at churches, over at the Department of Social Services. We have providers going back to the schools. So we have several providers, including the Public Health Department, who has been working with Office of Education and school districts to get the vaccine out and make it available in, the communities where people live. So a lot is still going on. And just a few details about vaccines. So let me tell you, in Imperial County, we are still all providers together administering anywhere from 5,000 to 6,000 doses every week. So although a little slower, they're still busy out there. And as far as percent of our population vaccinated, let me tell you, we're doing a pretty good job there. In Imperial County, we have close to 63% of our eligible population with at least one dose of the vaccine. When it comes to fully vaccinated, we are at a 46% fully vaccinated. That means they got 2 doses of Pfizer or Moderna or 1 dose of Johnson & Johnson.
Okay, and the vaccine is free. Okay, I mean, you don't pay for it. And if you have insurance and they can bill your insurance, I believe like the pharmacy would, but there's no charge to the individual.
No charge to the individual. And yes, if the person has insurance, the provider will try to bill insurance to, recover some of the administrative fees, but no out-of-pocket cost for the individual.
Okay. And the governor has, he's put some incentives into the mind of people that maybe are hesitating about getting vaccinated. I understand a little bit later this morning he's going to announce the first $1.5 million lottery winner in the vaccine lottery scheme. What kind of incentives are flying around?
So there's a couple. So the governor, this is a state initiative, announced that there would be $15 million in prizes. It would be 10 winners to be selected to receive $1.5 million each. And you're eligible if you live in California, are age 12 and older, and have received at least 1 dose of the COVID-19 vaccine. Now, those that received a vaccine early on, they were automatically entered into this. Now, there's other incentives, and it's the $50,000 Friday. And so anyone with at least 1 COVID-19 dose in California is automatically entered to win $50,000 on Fridays. This would be on Friday, June 4th, today, and another one on the 15th. Another 15 individuals will win on Friday, June 11th, not June 15th. And then again, the eligibility stays the same. You have to live in California, 12 and older, and have had to have at least 1 dose of the COVID-19 vaccine. That's not all. Anyone who has not yet been vaccinated, there's gift cards, $50 cards. These are virtual cards that can be spent online, or a grocery card, a grocery gift card from some stores. So supplies are until they last, and same eligibility requirements. Must live in California, 12 and older, and this started May 27th.
Okay. And I have to share with you an email I got this morning. Okay. It says, I was assigned to give you your $8.65 million COVID-19 package as charity welfare relief program. Please do let me know how I can reach you. Please enter the following information so that your prize money can be transferred to you.
Oh, no. No. Be on the lookout for those kind of scams. So no. That wouldn't be us.
I was looking forward to buying an island in the Caribbean. Okay.
I bet.
I think like with any opportunity, Carroll, sometimes people find that as an opportunity to take advantage of other individuals who may be looking for some assistance or anything to that effect. And so I think it's important, though, and we'll work on this as well, is getting some messaging out to make sure that people are on the lookout for that. So that way they don't fall for any of those potential scams that may be out there. But we appreciate you bringing that to our attention because that's very important.
Well, one of the tip-offs to me was it's an AOL mailbox. So, anyway, Becky, well, you're here. Okay, coming up June 15th is what the governor has said will be the reopening of the economy. What plans is the county, what plans are they undertaking to, if I may say, return to normal?
It's more of a slow reopening. We have started gradually recently as of the beginning of this month within our different departments. And so we're doing so, bringing employees back little by little. And that way we can soon, once the state also allow us to again be able to reopen. But as I said, it's going to be gradual. It's going to be something where we're going to have to really test the waters in the beginning as well to see how that will work. It will not be just a general, like one day where all of a sudden reopen to the public. We will still have some appointments in some areas. It's all going to be also dependent on the atmosphere and the environment and the space because we still need to allow for social distancing in some spaces. So we're working on that plan. We're going to make sure to share it with the public as soon as we have more information available to share.
Okay, is there any requirement by the county that employees must be vaccinated?
No, we do not have that requirement.
Okay, and the recommendation that I saw this morning from the state, and it's the state OSHA, is that if everybody in the office is vaccinated, you don't have to wear a mask or socially distance. And again, I think that's another one that's kind of up in the air.
It is.
As to how that will go.
Yes, it is, Carol. And they met yesterday, and there was a lot of back and forth. It was actually a really long meeting, which our health officer was involved in. So, yes, a lot is still up in the air. Okay.
We're looking, last week was Memorial Day weekend. If we're going to see a surge coming out of that, it'll probably pop up next week as far as the numbers are concerned. Are you anticipating or preparing for a possible surge after the reopening?
We're always prepared, Carol, for any type of surge. But our numbers are still on the downward trend, and we're hoping that it continues. We're also hoping that our community took the needed precautions when, gathering with others, participating in events, or traveling. But no, most definitely, we have gone through two major surges, and if there were to be another surge, we're definitely better prepared.
Okay, very good. Did I miss anything?
No, I think we pretty much covered it.
Okay, we appreciate the updated information. And Becky and Janette, we appreciate the visit. and I'd much rather talk to you two than talk to Tony.
Don't let him know that.
I'll never tell. Okay.
All right.
And
thank you.
we, next week, maybe we'll have some more updates on the reopening of the economy.
Yes, for sure. We'll keep you all posted on that.
Okay. Thank you. That's Janette Angulo, who is the director of the Imperial County Public Health Department, and Rebecca Terrazas-Baxter from Imperial County, and updating the COVID-19 situation in the Valley.
The best oldies on the radio. AM 1230 KXO.